They took your name, your land, your language, but not your legacy. Reclaim it at AfricanAncestry.com.
Can you explain how the nerves in the spine are connected to the function and health of major organs in the body?
A lot of moms who are infertile, right, and they're having a tough time getting pregnant via different things. Most of it is coming from nutrition, but also primarily, even if they get proper nutrition, if their spine's not in a balanced state, then it's very challenging for them to also keep the baby based off of the blood not clotting is one of the big things. Some people they have MTHFR, which is an enzyme in the body that doesn't allow the blood to clot or coagulate properly. So whenever they are developing this baby, it's like bleeding out and they're having miscarriages a lot. And so with them, a lot of these moms are on folate. And so they are, no, not folate, folic acid. They're on folic acid, which is causing the baby that issue with MTHFR. That folic acid is just straight creating that same issue where they're having those miscarriages. So a lot of times when they're taking these prenatals, I make sure that they're not on that folic acid, and I actually give them true methylfolate or B12, and then that usually helps these moms have it along with balancing out the occiput and the sacrum, because that's the pump of the cerebral spinal fluid.
Because I remember a doula told me she does recommend that women during their pregnancy go see a chiropractor.
Yeah. Absolutely, yeah. So, whenever you're going through pregnancy, your body's going through all those changes, it actually changes into like a hyper lordotic state as the baby starts to grow, and especially in that third trimester is when they grow the most. That back starts to get into this hyperlordotic state, which is causing compression, like I was kind of telling you as well, on the L5, S1 area, which dictates the nerves that go into the legs. So most of them usually pick up sciatica. A lot of them have a lot of like pelvic discomfort, which we do techniques through Hand Alchemy, which is like a form of Webster, but where you release the round ligaments, you release the sacral tuberous ligament, and all these help get that pelvic bowl in such a position where most of our moms that come through and have our care, they do natural births. Yeah. Most of them don't have like breaches or C-section, emergency C-sections. They usually just have such a perfect, because we get that pelvic bowl in such a position where they're not in pain, and they also their pelvic bowl is ready for that baby to just flow out. And so we get them there mentally too, as far as getting their mind in the right place before they get into something like that, because it's such a sacred thing to be able to bring a child into this, this world. So